Hi, my name's Christina and this is my NG tube insertion video. First, I would want to verify the healthcare provider's orders. Next, I would want to gather all of my supplies, starting out with my NG tube, some tape, my gloves, my 20 to 60 ml syringe, my pen light, some water soluble lubricant, a cup of water with a straw, our wash basin, a pH test strip or meter, and a towel. We'd also want to have a suction apparatus with tubes and canister connected if that was prescribed, which we do not have that because it was not prescribed for my patient here, Mr. Smith. So now we would perform hand hygiene. And I would go ahead and don my gloves. Introduce myself to the patient, verify patient with two identifiers, and provide patient privacy. Close the door or the curtain. Hi, Mr. Smith. My name's Christina. I'll be your nurse today. Can you please verify your name and date of birth? He verbally said his name and date of birth. I also checked his wristband. They matched. So today, Mr. Smith, the doctor ordered an NG tube to be inserted. This is basically a tube that goes from the tip of your nose down to your stomach. This tube is going to be hooked on low continuous suctioning, which will help to clear out the stomach to make sure that there's no stomach contents, to help give your bowels some time to heal. Does that sound okay, Mr. Smith? All right, perfect. Next, I would want to raise the bed up so that it's a good working order for me. I'd also want to position my patient in high Fowlers, if that's tolerated. So I'll go ahead and put Mr. Smith up there. Mr. Smith, is that okay? Perfect. So my patient is comfortable. Next, I would start by taking my NG tube, and I'd want to go ahead and place it in the basin of warm water. This helps to make the tube a little bit more flexible, making it a little bit easier to insert that. And next I would take my towel and I'd want to set up our towel under our patient. Okay, perfect. Then we would ask our patient to go ahead and hyperextend their neck back, just so that I could inspect the patient's nares with my pen light, to observe the intactness and of the tissues of the nostrils. All right, Mr. Smith, that looks great. While I was doing that, I also want to examine for any obstructions or deformities in the nair. We would also ask the patient to breathe out of one side of the nostril while closing the other side, to determine which side has the better airflow. I'd hold this side. Go ahead and breathe, Mr. Smith. Okay. Okay. So it seems like the left nair has the better airflow. So that's the nair I would be using to insert the NG tube. So next I want to go ahead and grab the tube from the water basin. And I want to go ahead and measure my tube. And I want to measure from the tip of the nose to the tip of the ear, down to the xiphoid process. Okay, and it looks like we're measuring about 50 centimeters. So I'm going to want to go ahead and grab some tape, mark that off so that I remember where to stop placement of my NG tube. Okay. I'm going to go ahead and have Mr. Smith hyperextend his head back as I would insert the tube, and as it reaches the back of the throat, I would want to go ahead and have you lower your chin to your chest, and then I'm going to have you grab some sips of water as I slowly advance the tube a little bit farther. Does that sound okay, Mr. Smith? Okay, perfect. So I'm going to go ahead and lubricate the tip of the NG tube before I begin. And also, Mr. Smith, if you start to gag or have any difficulty breathing, please raise your hand, and I will stop and I'll allow you a minute to collect yourself then. All right, Mr. Smith, I'm going to go ahead and insert. Please hyperextend your neck back. I'm going to go ahead and insert the tube with our patient into that left nostril. Have them looking up. And if they gag on initial insertion, I would want to go ahead and remove the tube and try the other nair. We will then follow the nasal passage back, and when it reaches the back of the throat, oral pharynx, the patient will start to gag. Then we want the patient to put their chin to their chest, and at this point I'm going to have him drink some sips of water while I insert the tube. As he's taking a sip of water, I'd want to go ahead and advance the tube about 2 to 4 inches more while he's swallowing. Swallow. You're doing great, Mr. Smith. We are almost to the end. Go ahead and swallow. Okay. If your patient has any gagging, we'd want to stop and let them take a couple minutes, take a couple sips of water, just until the gagging has stopped, and then we'd want to continue just to make them feel comfortable. All right, Mr. Smith, we continuously inserted the tube until we hit our 50 centimeters marked. So then we want to verify, make sure we are there. Everything looks great. We're going to want to go ahead and tape the location onto his nose so that it stays in place. Okay. Perfect. Then we're going to want to take our syringe, and we are going to want to withdraw 5 to 10 milliliters of that gastric content. And we're going to want to place this into our specimen cup. Then we want to go ahead and take our pH test strip into our specimen cup, dip it, and make sure our pH strip shows 1 to 5 pH, which would indicate that we are in the stomach and the tube is in the stomach, which it is. The pH looks great. It's at a 3. So once we have confirmation from that test strip, we are going to want to make sure that that tube is in place well with the tape. It's secure on his nose. Perfect. How you doing, Mr. Smith? Doing good. Okay, and then we'd want to go ahead and lower the bed. And if any signs show that we don't have the correct placement of the tube from the pH, we would have to remove that tube and then begin again. So once the bed is lowered, we want to lock it. And we want to also get an x-ray to make sure that that tube is in the correct area in the stomach. We will also secure the tubing to the patient's gown with a safety pin. So we'd want to go ahead and secure that to the side here. Okay. It looks like the x-ray was great. So if we had continuous suctioning and we had confirmation from the x-ray again that it was in the correct area, we would connect this to the continuous suctioning if the provider did order that. And then we would go ahead and verify that the NG tube and the suction tube stay unclamped and patent. We would also assess any content that is in the suction canister and document any findings, including the amount and the characteristics of the content in the canister as well. We would also want to finish with our patient. We want to make sure they're comfortable, they're in a lowered position. Mr. Smith, are you comfortable? Okay. We'd want to discard our gloves, discard all of our supplies, clean up after ourselves, toss anything that we used. Take our towel. Okay, we'd want to go ahead and perform our hand hygiene. We'd want to go ahead and document our procedure. We want to include any care that we provided, assessment of our patient, findings, and also the patient's response to our procedure.